So is that what we're supposed to do? Are we good to start? I think so. All right. Welcome, everyone. Thank you so much. I'm Mark Galley. I'm the Secretary for Health and Human Services for the state of California, and it's a real privilege to be here in Downey, California at this Kaiser facility. Thank you to our colleagues, partners at Kaiser for opening up this warehouse. We just had a chance to see the incredible work that happens here, meet with many of the folks that not just work here, but work across the system, and just hear how it's going. And I just want to say on behalf, as a physician leader here in California, to all those who are in healthcare, who are working just their tail off throughout this pandemic, whether it's here in the world of pharmacy, at clinics or hospitals across the state, making sure that the care is done well, done with a great deal of dignity and compassion. I just want to thank all the workers who make that happen. We've been through quite a journey over the past few years. This state has done things that few other states have done in terms of their impact on our communities, on our population, when it came to protecting us through the pandemic. But today, we're actually here to talk about something that predated COVID, before we even knew what COVID was and what we were thinking about. The governor, his first action was to sign an executive order that was really the kickoff of a California for All, paying attention to the fact that the rising cost of healthcare on all sorts of levels was impacting Californians, and that we had to step in and do something. And on that first day of office, that executive order directed many of us in state service, but certainly my agency, California Health and Human Services, to take a look at how we can effectuate change, not just for those we took care of directly in the Medicaid program, but for all Californians. And just a few miles away from here, we were there, Supervisor Hahn, the governor, at Rancho Los Amigos, talking about how we were going to bring public sector partners, both at the county and the state level, together to exert the buying power of a state with 40 million people to reduce the cost of drugs. And that has delivered in some really important ways, saving money for Californians. Additionally, we did something called Medi-Cal RX, where we said we can save up to a few $100 million a year by changing the way we pay for medications in the Medicaid program. But that wasn't enough for the governor. He said we need to do more. He challenged us to come up with ways to think about how do we really disrupt the market? How do we really start to change the impact on average Californians across the board? And that led to this idea of California RX. How can we, 40 million people strong, take our power to really disrupt markets by creating our own medications? My team had the privilege of working with a number of partners. Some of you are here in the room, to identify, well, where were we going to start? And frankly, all arrows pointed to insulin and diabetes. And you're going to hear from a number of really eloquent speakers, including the governor, about why we're here talking about diabetes and insulin. But Governor, I just want to thank you for your leadership and your follow-through, right? We've done a lot, but this is the effort that has been the longest journey. Not because it's taken every single minute of time from people, but because this has been something we have sought to do right. We have sought to really choose partners wisely. And today, we're going to talk with one of our leading partners, Civica, and Jennifer Spalding, who's going to come up and share a few words in a moment. But I just want to say that we do a lot in the state of California on healthcare. We're launching the Office of Healthcare Affordability. Dr. Pan, you'll hear from him, one of the board members, just next week. But this is really about changing the arc of the cost of healthcare for all Californians. And I'm proud that we're starting with insulin, but we aren't stopping there. We're going to keep looking for opportunities where we go next. And this is something that I know Californians should be proud of, the leadership of the governor and many, many around him who've said, we're not quitting on this. We're going to make it happen. I want to thank a few people that we couldn't have gotten here without. Vishal Pagani on my team, who is a really important thought leader, coordinated so much, and Richard Figueroa on the governor's team, who has been a fierce force for health equity and health access for so long. Thank you all for being here, Governor. Thank you for your trust in me and us, for your leadership, for your constant question and consult on how to do this the right way. And to our partners at Civica, Jennifer, thank you for joining us here today, and I welcome you to the podium.
Thank you, Dr. Ghali. Thank you, Governor Newsom. I am pleased to be here today on behalf of Civica and so excited to be entering into this partnership with the state of California to solve a problem and bring insulin to the state of California and people who need it. Let me tell you a little bit about Civica. We were founded in 2018 by a group of thought leaders in the hospital space and in philanthropies. We were founded to solve a problem of critical drug shortages in the US, and we are a nonprofit pharmaceutical company. In 4 short years, we have delivered 120 million vials of medications to US hospitals and over 75 different drug presentations. We have one overarching principle at Civica, and that is to do what's in the best interest of patients. And because of that mission, we have expanded our efforts outside of the hospital to focus on bringing down the cost of healthcare for consumers at the pharmacy counter. And that has led us to tackle insulin. As you'll hear from the governor shortly, diabetes affects millions of Americans, and they rely on insulin for life-sustaining care. Civica will manufacture 3 insulins, the most commonly used by US citizens. It is Glargine, Lispro, and Aspart. We are thankful for the significant contribution from the state of California, and we are excited to bring CalRx branded insulin to Californians who need it. The state joins other philanthropies who share our mission. California-based Gary and Mary West Foundation, the host here, Kaiser Permanente, and Blue Shield of California, just to name a few. Together, we will go down this road of a mission of making quality, affordable insulin available to everyone who needs it. Today, this partnership is a great step in that direction. Thank you. And now I'll turn it over to Dr. Pan.
Thank you, Jennifer, and it's really an honor to be here. I'm Dr. Richard Pan. I'm a pediatrician and former state senator and author of the legislation to authorize CalRx. And I think back to when we were thinking through this idea. This is an idea that's been floating around. People have been talking about it. I think let's put it this way. I and my physician colleagues know how frustrating it's been to get medications to patients, but more importantly, patients themselves are even more frustrated in not being able to get access to their medications they need to keep themselves healthy and to actually, frankly, to save their lives. You cannot live without insulin if you have diabetes. You cannot live without insulin if you have diabetes. And so this dysfunctional way of pricing and paying for medications is causing a lot of suffering. And so one of the discussions out there, ideas was, okay, well, what would happen if you had a public entity or a not-for-profit entity actually provide medications at cost to people so that we have a safe, reliable supply of affordable medications? And I was so excited when the governor, in his budget proposal, put forth this idea. We've been exploring this when I was a state senator as well. We were looking at this idea, but the governor's leadership in saying, yes, California can step forward. A lot of states were doing a little bit of, so for example, Massachusetts was manufacturing some vaccinations. Here in California, we're doing some stuff on botulism, et cetera. But to say, no, California is going to make that investment. And this partnership with the legislature, really appreciate Dr. Ghali and his team working with us. But the governor's vision in saying that, yes, California can step forward, change the nature of the market so that we can address those frustrations, the frustrations patients have, the frustrations the doctors are taking care of them have, and say that, no, California is going to manufacture insulin, not only insulin, by the way, the original legislation pointed out insulin, but actually said 10 drugs, and we can even go beyond that. To manufacture these drugs, to do it in a way that is straightforward to patients, right? We're not, no discounts, no gaming around. We're going to produce them at cost. In fact, I expect some of the pharmaceutical companies are going to try and underprice us in the beginning to see whether we're really serious. But we are serious. We are serious here in California. And I want to thank the governor and his leadership. It's going to happen. I'm so excited to be here to hear about his announcement today. It's going to happen, and we're going to do right by the people of California. The people of California will so very much benefit from this, and I'm proud also to be a physician, still taking care of patients. I'm looking forward to my patients benefiting as well. Thank you so very much. And now I'm pleased to introduce Assemblymember Blanca Pacheco to come up to a podium who represents this community. Thank you.
Hello, everyone, and welcome. Welcome to the City of Downey, which I represent as the Assembly member for the 64th District, and where I also served on City Council and as mayor in this great city. But I also want to acknowledge and thank our Mayor, Claudia Fermetta, for also attending. Thank you. We can give her a round of applause. It is truly an honor and a pleasure to welcome the governor on his tour of the state. It is exciting to hear about the governor's announcement on securing a contract with the manufacturer to make $30 insulin available to all those who need it. This is an exciting announcement because it speaks to the governor's promise to bring down the cost of prescription drugs for all of Californians. Californians should not be forced to go into debt in order to obtain this life-saving medication. I look forward to working with the governor and his office in implementation of this valuable program. Y ahora, para que los que hablan español, buenos días. Mi nombre es Blanca Pacheco. Soy la asambleísta para el Distrito 64, que incluye la ciudad de Downey. Esta fue la ciudad donde yo estaba en el concejal y donde yo fui la alcaldesa para la ciudad. Y nomás quiero reconocer a la alcaldesa Claudia Fermetta, que también está aquí en el local aquí. Es un honor y un placer dar la bienvenida al gobernador en su gira por el estado. Es emocionante escuchar el anuncio del gobernador sobre el nuevo contrato con un fabricante para la insulina de $30 esté disponible para todos los que nos necesiten. Es un anuncio emocionante porque responde a la promesa del gobernador de bajar el costo de los medicamentos que es necesario para nuestras comunidades. Nuestras comunidades no deben de ser obligados a quedarse en deuda para obtener los medicamentos que sean necesarios para ellos. Espero trabajar con el gobernador y su oficina para implementar este programa. Y mucho gusto y gracias y que tengan un buen día. And now I have the pleasure and privilege of introducing Senator Stephen Bradford.
Good morning. And it's truly an honor to be here, and I want to thank Dr. Pan for his visionary leadership in authoring the legislation that's gotten us here today, for the governor and his courageous leadership. And I'm going to quote the governor. He often says, California is the next coming attraction. And this is a prime example of California leading the way in healthcare and reforming the market. As an individual who's been elected for over 25 years, the number one issue outside of keeping a roof over someone's head is affordable healthcare and access to healthcare. As an individual who grew up in a medical household and who left for college to become a doctor, you see how that turned out. I'm really excited about what we're doing here today, and when I talk to constituents, their number one concern is not climate change, it's not having an electric car, but it's access to health care, affordable health care, something that they can afford to stay alive. I just saw a story last week of a young man suffering from diabetes, and his parents couldn't afford the insulin. So he secretly was rationing his doses and reducing them. Sad to report, he passed away. No one should die in California. No one should die in this country because they can't afford access to medicine. This partnership will make sure that's possible, and that's why in January I introduced SB 873, which will totally reform California's pharmaceutical rebate policy, where 90% of the rebate will go to the customer at the counter and not the provider or not the pharmacy itself where the rebates have been going. So it will go directly back to the customer who deserves it, who will feel it in their pocket on a daily basis. That's what we need to do. So I'm excited to be here. I'm excited to hear all the amazing things that we're going to do in this space to make sure that healthcare is not only accessible, but affordable as well. So next up, I have the pleasure of introducing Nikita Kalam Harris. She's Advocacy Committee Chair for the American Diabetes Association of Southern California.
I'm a shorty. Good morning. So as he said, my name is Nikita Kalam Harris. I'm an actress, adjunct professor, and I am the Advocacy Committee Chair for Southern California at the American Diabetes Association. So I myself have been living with type 1 diabetes for 8,673 days. I've given myself 60,656 finger pricks, and I've given myself 60,711 insulin injections since being diagnosed in 1999, my freshman year at UC Santa Cruz. It was during my college days that I first felt the impact and necessity that insulin affordability pays in my ability to survive life itself. Young adults living with diabetes are in this unique space coming off of our parents' insurance for the first time. When I came off, I didn't even qualify for any of the insurance I applied for due to my pre-existing condition. Because of this, there were many times where I was scrambling, trying to muster up $100, $200 for a little vial of insulin that was literally going to keep me alive. I would apply to enroll in clinical trials, hoping that I would be in the real insulin group instead of the placebo insulin group. I once went without insulin for just 5 hours, and I was in the ICU for 2 weeks. So when I studied overseas, I didn't have any of these problems. So when I came back home, I was like, come on, guys. I have neuropathy, which is nerve damage in my legs and feet, and I have gastroparesis, which is nerve damage in my stomach. 2 conditions I believe I would not be standing in front of you today living with if I had affordable insulin and access to management tools that all people living with diabetes should have access to. So there were people choosing between rent or insulin, like was mentioned before, groceries and insulin, literally feeding their families or spreading out their dosage so they can keep the insulin vial longer. I am now a mother of a 2-year-old daughter, and I want to be here so that I can see her with my husband grow up to be a beautiful young woman. America likes to be a leader in the world for many things, but I ask that we be a leader in caring for our citizens. Thank you. And I would like to introduce Governor Newsom.
You're not getting this? Thank you. I wish they kept that behind. Nikita, thank you very much. Thanks for putting all of this in perspective. All of you, thank you for the privilege of your time and the opportunity to share this good news and progress on a promise that we promoted a number of years ago. I'm particularly pleased to be here with you, Madam Mayor. Thank you for hosting us. Thank you to Janice Hahn, always for her stewardship, faith, and devotion to causes like this, including the cause that brought us together 4 years ago, as Dr. Galley said, in terms of initiating components of what we're advancing here today. Senator Rubio, thank you as well for all of your steadfast support of this effort and initiative, and thank you for being there when Dr. Pan and Senator Bradford and others, your colleagues, introduced the efforts to advance this specific announcement here today. To Civica, thank you for being a social welfare organization. Thank you for being willing to disrupt the market. Thank you for being willing to save lives without fear of failure, but more importantly, without money being your motivator, without money being the dominant meme and value. And as a consequence of your example, we are blessed to advance a 10-year partnership with you to advance our CalRx initiative. And as a consequence, to not look to market share, but to look to market disruption, to advance the cause of not subsidizing the cost of drugs and socializing the cost to each and every one of you, but to address the underlying costs by lowering the cost and providing it at cost to customer, regardless whether or not you have insurance. This is a big deal, folks. This is not happening anywhere else in the United States, and do not be misled. These companies that all of a sudden are jumping over each other to rush in this direction, they're just providing discount cards. Those costs are being borne by the plans. Those costs are being socialized and shifted to everybody else. What this does is a game changer. This fundamentally lowers the cost, period, full stop. And if I'm an insurer and I'm receiving some for $30, conceivably, they may eliminate the copay completely for something that costs so little. We're talking about lowering the costs on an annual basis, 10x in some cases. $30, 10 milliliters. You're getting that typically behind me for $300 plus for the pens, $55 cap for 5 packs of the pens. You're seeing that north of $500 minimum in most cases. You've got 3 major players in this space. And by the way, as Dr. Galley said, this space has been around 100 years. And in the last few years, we've seen a tripling of costs because, again, there are only 3 major players, and they tend to follow each other. They tend to follow each other. Time for disruption. And that's where California comes in the spirit of Senator Bradford. Yeah, the future happens here first. We are America's coming attraction, and we take pride in that, and we feel a great sense of responsibility to do more and be more. And as a consequence of this initiative, we are not stopping here. As was stated, the opportunity, some women made this point, others, we have the opportunity now to explore other manufacturing opportunities, and as a consequence, disrupt more markets, lower costs, more costs for real folks. And I'll just give you a preview. Next up, naloxone. And that's a serious issue in this state and in this country. And we are pursuing those partnerships in real time because of what the legislature afforded us to do. And I cannot impress upon you, we had an idea, they put the legislation practice, and now we are implementing it. $100 million we set aside, $50 million to do manufacturing headquarters here in California. This $50 million will be establishing a framework where there will be manufacturing outside the state, but for the benefit of the state. We have clawback provisions. We have best price provisions. We have soup to nuts delivery of the entire product, $30, no more, no less. We looked, trust me, I read this damn contract because I didn't want to be fleeced. This is not a space where you can be timid or shy. This is a space where seemingly everybody seems to be making a quick buck somewhere along the lines, and that is not the case with the partnership with Civica. Is this perfect? We don't know yet, because this is about 2023 and then into 2024. And so what we're announcing here today is the formalization of that partnership, that 10-year framework of commitment, the fact that we're making real, again, in closing, as I began, the promise that we promoted some time ago. Final point, because Dr. Galley made this point, and I'm really proud of it. There's no state in America, none, period, not one, that comes close to doing what the state of California has done on healthcare. And we have a lot more work to do. We became the first state in U.S. history to provide universal health care regardless of pre-existing condition, ability to pay, or regardless of your immigration status for everybody. That is a point of pride, and it's something we have to continue to remind people of. No state does that. And we're moving the principles of purchasing power in the principle of single payer by being a single purchaser to leverage our purchasing power. If we are arguably now the 4th largest economy on planet Earth, we got to start acting like it. We're the size of 21 state populations combined, and we can do so much more to leverage. And that's the spirit of CalRx. It was the spirit of Medi-Cal RX and the single purchasing pool strategy. It's the spirit of this health care accountability that we will be advancing next week with this new Office of Healthcare Accountability that, by one estimate, UCLA, I think, did a study, looked at $42 billion of potential savings if we do this right. This is very exciting. Transparency, price targets, now looking to lower costs, just not expand coverage, and a deal with the underlying reasons these prices continue to grow faster and faster beyond inflation each and every year. So look, if I can go on, I will end. I'm just really proud of this. This is hard work. We stuck with it. Incredible partners in the legislature. Thank you. And the public that demands and expects us to do more and better on their behalf. Again, only in California, eat your heart out, the rest of the United States. Thank you. With that, all these fancy folks are available to answer any questions, if there are any questions. If I were with Eli Lilly, I would ask a few questions, but that's just me. But
I'm Lydia Pantasas with Spectrum News 1 SoCal, and I wanted to know if it's both short-acting and long-acting types of insulin that are going to be produced.
These are the three. I'm gonna bring you. The answer is the better of the two. And Dr. Galley will talk about the three.
The short answer is yes. The goal is to have a diabetic often needs a variety of different insulins. There's a regimen that's prescribed. It's changed from time to time, but it's often a combination of the various different long, short, ultra-short acting insulins. And what the partnership with Civica is going to deliver is the varieties of insulin to make sure somebody's entire regimen is covered.
Thank you.
Hi, thanks. Emily Alpert Reyes with the LA Times. Could you just clarify this contract? First of all, has it been signed? What's the duration? What's the amount? And then when are you anticipating that CalRx insulin will be available to Californians?
So $50 million, the cost of the contract. We have two steps. The manufacturing will begin later this year. The FDA approval, there's been multiple conversations. Civica could talk a little bit more specific if you'd like about this, though anything we ever talk about with FDA, we may want to talk less about it, not more about it. But we are anticipating favorable, based upon the conversations we've had, favorable review and allow us to execute early next year. So it's a 2024 delivery in terms of timeline. Here's where the contract provisions go into effect. They're 10-year contract provisions once delivery is made. So that will be codified on the basis of when the delivery occurs. But we have a tentative framework that started in February, just a few weeks ago, 2023, that initiates that process and then gets trued up on the basis of that first delivery date. We also have provisions to the extent you would like them. And let me offer this, because I'll have my team work through some other of the contract provisions if you're interested. Requirement that we participate on the board, a requirement if the board expands that we get our prorated percentage share of board seats. There are a lot of protections for the taxpayers of the state of California. And then more important than anything from my humble perspective is the pursuit to invest the other $50 million in bringing the manufacturing actual jobs here to the state of California. And we're well on our way in terms of that pursuit as well.
And then, sorry, on the naloxone portion, are you looking specifically to produce nasal or injectable naloxone or both?
All of the above, available over the counter in pharmacies, part of our naloxone distribution project, which you may know well. We invest about $50 million, coincidentally, a year. In fact, the budget that I just submitted for consideration to the legislature includes an additional $79 million this year. Puts in perspective the costs just in that one program that the state is funding, and that initiated these conversations of why we're not looking to provide some market disruption in this space as well. Those discussions have advanced. I don't want to destroy the prospects for a successful outcome by saying anything more than that, but I am leaning in with a little reputational consideration that we are pursuing this. Thank you.
Governor, Mike Blood with AP, and I wanted to go to that question of taxpayer protections. Every business venture, of course, has risks. You're going to be entering a competitive marketplace where there are already strongly established players. They are familiar brands to people who use them. What do you see as the possible risks for the state with this? What if they're already, Dr. Pan mentioned, you could get undersold? Is there some way in which this doesn't take off and backfires?
Well, look, I think we've already had an outsized influence on impacting the decisions of these three big brands. We've already, on the cost-benefit side, California has already come out, just looking domestically at the 40 million people we represent and the subset of those that are utilizing insulin. We're already on the beneficiary side of that equation. That said, the provisions in this contract on best price and the provisions in this contract afford us, I think, very ample protections. I am not naive how many times, I've been around long enough to know, press salivates at opportunities to expose bad deals that public sector makes in the private sector. And so that's why I said we reviewed this contract in detail. The provisions of our board representation were sacrosanct. The $30 is the full total cost, production, manufacture, and distribution of this drug all in. It is the actual cost. It's not a subsidized cost. It's not a card, discount card. It's not borne more broadly in the entire system. Something like this simply doesn't exist anywhere else. And we are intent to make this about market disruption. And I think it would be spectacular if all these other companies fell even further in their price considerations and dropped well below this. And that would create a totally different dynamic. And I think Civica, as a social welfare organization, would put us in a position where we would dynamically address that in a very favorable way. They're not looking to make a buck. This is at our cost collectively. And that would drive down the cost for everybody else. So I think we're in a very good place, and we're going to know more in a matter of next few months as we get through this FDA process.
And can you back out of this deal if for whatever reason?
Yeah, I don't want. I'll give you all the contract provisions, but we'll provide that. Yeah, there's all kinds of provisions that would allow us to exercise and to pull out. And by the way, we get all the intellectual property rights. I'm not even a contract lawyer, but now I'm going back in my mind about this contract. So I'll give you all those details so you can take a look.
The last question. The legislature has put up, I think, $150 million toward this. Is
100.
Is it 100?
Yeah, but 50 million specifically for the announcement that we're advancing here today. 50 for a separate but component part of.
Yeah. Do you see another need for funding coming? Is there anything that you're going to
I don't.
propose
Not
where
in
more
the short
needs to
run.
be
I
put
mean,
into
these
this?
not in the short run. But look, the CalRx project, the whole idea is a dynamic process. This wasn't a one-off. This is about not just a value proposition, but it's an organizational construct that we're creating to advance policy in the state to lower costs for the taxpayers and ultimately for the plans and everybody else. And so, no, I hope we'll be investing more. We've got to remember, this is one component part of what we're doing in the pharmaceutical space more broadly, where we're investing billions and billions of dollars. So this is a relatively small part, but it's a profoundly impactful and disruptive part.
Greetings. My name is Mike Tauber. I'm a cameraman with ABC, so please bear with me. I'm going to have
Good, man. We're all multitasking,
Thank you. I expect a raise soon. Thank you. All right, so my newsroom just asked me to ask you these two questions, and then I'm going to run back to my camera.
Oh, yeah, okay, I'll take them.
All righty. So it's the first question is, is there any additional funding or plan or impact on the current opioid crisis?
Yeah. Good. You want to get to your cameraman? I'll answer that question. Yeah,
take
your time, brother. We're good. It's an important question. Where are you? I'll look in the camera. So specifically on the opioid, so I separate opioids from the issue that's so topical right now as it relates to fentanyl specifically. And we have component parts in the opioid plan more broadly. In the last 4 years, we've invested literally over $1 billion in our opioid strategy and plan. That includes, by the way, $40.8 million specifically for awareness for young folks. In terms of the fentanyl issue, more precisely, this year, we're setting aside $93 million, of which $79 million goes to the naloxone distribution project. You may have seen, read, you may have actually reported the work we're doing in the middle schools and high schools in this state to make these available. I want to underscore the importance, the imperative. We had 120,000 known reversals last year in 2022 as it relates to our naloxone distribution project. The impact, quite literally, is saving lives at scale. This is a serious issue, so serious that working with the legislature this year, not only from a public relations awareness perspective and training and providing medical treatment and assistance as it relates to substance abuse, but we're also working on enforcement at a whole new level. We already have 144 National Guardsmen and women down at the border and working in task forces throughout the state of California. That's a new program we just launched. We'll be talking more about that on Sunday, tomorrow, down at the border, in fact. And we are committed, all prongs of our approach to fentanyl, to address this crisis. And do not, as a parent, do not think for a second I don't lose sleep over this. We're taking it very, very seriously. Oh, sorry, man, you got 2 questions. All right. All right. Now you couldn't even edit that one. Now you got to be an editor, too.
Yeah, I am going
Jesus.
to.
Yeah. I'm sorry.
So it's sort of related to piggyback on what you were just mentioning, but do you have any response to Mexico's president saying that the fault for overdoses and our addictions here in this country lie within the U.S. and not with Mexican cartels?
Look, I read it, I processed that, I've reviewed it, and I'll just say this, I don't care who the hell is to blame at this stage. I want to know what to do. This is serious. And anyone who suggests or doesn't believe it's coming through southern border is fooling themselves and misleading you intentionally. We know where the component parts are coming, precursor parts from Asia, primarily China, but we're also seeing a lot of the manufacturing and massive amount flow coming across the border. That's exactly why we brought the National Guard down there to supplement the work on the X-ray machines and supplement the work in terms of data collection and enforcement, putting the cases together against some of these international organizations. We have, by the way, just last year, through the National Guard and our other task forces working with local law enforcement up and down the state, 29,000 pounds of fentanyl were seized. And that's just, it's 500+% more than the prior year. That's just what was seized. So this is a serious thing. You have to be sober about this. Can't be ideological about it. This is not about liberal, conservative. It's not about who's right or wrong. This is a serious, serious issue for this country, and too much of it is flowing across this border in the state of California. And we are mindful of that, and we are supplementing a lot of the federal work, and I'm very proud of the support the legislature has provided in that space.
So I believe that is our last question, sir.
Well, that's wonderful. I appreciate the question. More importantly, I appreciate everybody that was part of this, and thank you for believing in this. And I hope this has a real impact on real people, and I hope this does disrupt the entire market and we see prices collapse in this space. Thank you all very, very much.